Hi, I'm Dr. Doug Richie. I want to talk to you about the Richie brace and how it can improve patient outcomes in your practice and also improve profitability. Not only the Richie brace, but other forms of durable medical equipment can greatly enhance your practice. I'm amazed how many practitioners around the country have not yet implemented durable medical goods in their practice. And as I've spoken to them, I've learned that certain barriers exist that prevent them from doing this. One barrier is simply filling out the application form to get a provider number from Medicare to dispense durable medical goods. This provider number is actually called a DMEPOS provider number, Durable Medical Equipment, Prosthetics, Orthotics, and Supplies. And the DMEPOS application is easily downloaded from the internet and takes less than a half hour to complete. Once you get your DMEPOS provider number, you can now bill Medicare for all of the Richie brace products, but also many other durable medical goods that are extremely useful in podiatric practice. For example, off-the-shelf ankle braces for trauma patients who present to your practice and need immediate immobilization. These products can now be billed to Medicare and you will be reimbursed. Walking boots are very popular to be used in surgical patients and trauma patients. They're handsomely reimbursed, they're very profitable, and they're very effective. Finally, diabetic shoes, therapeutic footwear with diabetic inserts can now be implemented in your practice and billed to Medicare. So simply getting this provider number will open up a whole new world for you in terms of practice productivity and profitability. Another barrier is a perception that there's a risk to dispensing a perceived expensive custom Richie brace to a patient for fear that Medicare will not pay for it down the line. And yet the reality is that once you get a DMEPOS provider number and begin billing Medicare for custom Richie braces and off-the-shelf Richie braces, you will find that the reimbursement is predictable. And in fact, Medicare with DME is a safer billing process than many other procedures you do in your office. For example, Medicare will pay for that Richie brace even if the patient refuses to pick it up or declines the brace on the day of fitting. You, the provider, will still be able to bill Medicare and get paid for it. Not too many other private insurances offer that. Another fear is the doctor may say that they're afraid of getting audited by Medicare. And as I've been in this business for over 20 years, I have rarely heard of a doctor getting audited for durable medical goods and losing the audit. For the most part, if you follow simple Medicare guidelines, you might get audited, but you're not going to lose the audit. We've gone to great lengths to provide you on our website with all the necessary materials to be compliant with Medicare, so that if they ask you for the patient's medical record to justify the necessity for the AFO device, you will be in line and you will get paid. So this whole process is actually very predictable, very reliable, and it has a long track record of proving to be worthwhile for you in your practice to bill Medicare for custom AFO devices.